Hey, welcome back. Lucas County Health Board is working to address violence in our area, taking a public health approach. This afternoon, we have Health Commissioner Karim Baroudi with us to learn more about this committee. This is not like this week this happened. It's been in development the last couple of months. What got us here?
Well, it's always been in the work of public health to kind of tackle violence, in certain areas, especially in schools. We've been involved for a long time, with school initiatives to help with violence, all kind of stuff. But we made it intentional the last couple of months since once the city, released their plan, their 5-year plan, the Peace in Motion. The board felt like we need to support that plan, especially if they're going with a public health approach to to tackle reduce violence.
I think everybody was aware of the health department's role during COVID. That was really a forefront thing, and that's all we ever really were having on the news every day about the latest developments with that and the health department numbers. But there are so many other facets to what the health department does. Explain all that.
Oh, there's so many things. We touch so many lives every day on many levels. We have 100+ programs that goes out of that building. We have about 100 staff that do initiatives and services on a daily basis on different levels, from schools to restaurants inspections, every aspect of life. Violence is a big part of what we look for intervention as well. I think adopting the public health approach to reducing violence is a great idea because those are proven to work. We go upstream, we go to the root cause of violence at so many levels. We look for triggers, we look for behaviors, we look for a lot of things, and we're out there. So I think adopting the public health approach to reduce violence at the community level is a great idea. So
this will be outreach in the schools because really, the biggest crime problem, or the shootings and everything else, it's kids. We had a story on gangs about a year ago, and the police were saying the shocking thing is 12, 13-year-old kids are out in the streets with guns. And that's a societal problem we got to deal with, but there's a lot of different ways, like you're dealing with the health commissioner, to try to find ways to get around it. Yeah, I think we are in the business of prevention. Public health means prevention. And I think we're always looking, especially kids are most impressionable on many levels, from the smoking to drinking to vaping. Sure. And violence is one of them. So they are impressionable. If we can find intervention points in the life of those kids to kind of not change the behavior, but kind of curb it when we see signs of it, or proven strategies to deal with it, I think it will be. We will have a lot more success that way. If you deal with it in schools, then you're talking about peers. If you're with a group of kids that are going to kind of do the right thing and stay away from the guns and stay away from the gangs and find productive things to do with their time. That's the thing. The kids that don't have anything else better to do, they go out in the street at night. They're the ones out there that get shot at 2 o'clock in the morning. Yep. And violence in general, it's a little bit of a complicated issue. It takes more than just the parents and the grandparents and the whole village. It takes more than public health alone. That's why coalition building is very important in tackling violence. Coalition building, we work with law enforcement, work with government officials, we work with the schools, we work with social services. It's trying to connect the dots here when we see behavior, when we see intervention points. I think that's the most important things. The more resources you can get, the better. Are you getting cooperation from schools and all the agencies that you need? City governments also involved. Yes, and I did talk about our involvement with the schools, not lately, but it's been going for a couple of years now. And we had a task force meeting, late last week. It was great cooperation. They're all at the table. They're all looking for solutions. They're all looking for intervention points. Again, if we go upstream and look at the root cause, we'll have a lot better success with curbing violence. Nuts and bolts, what are you doing? Boots on the ground? You're having people go to different schools. How is that all being activated? We do. That's being activated through coalescing. We're bringing law enforcement, we're bringing law and order, we're bringing the prosecutor's office, we're bringing government officials, we're bringing schools, psychologists, schools, sociologists, all to the table to brainstorm and kind of come up with the systematic way to look for signs, of violence, so we can get ahead of the game, ahead of the ball, and deal with it. It would be great if we get parents more involved too. That's maybe that gap homes that are not a complete family structure, and maybe the parents are not real up on what their kids are even up to.
And I think that's kind of one of the intention of the board to come up with that committee is to get everybody involved from all walks of life, all people involved. We call them stakeholders, but some of them are partners. But you know what? Not everything can be resolved at that level. You're right. We need to involve the families, the parents, the community itself to engage them in their own health and safety.
Karim, thank you very much for coming in today.
Thank you
Karim
for having
Baroudi,
me.
he's the health commissioner of Lucas County and doing great work there, and appreciate you coming
Thank
in
you
and talking
so
about a
much.
very important topic.